Hi, everyone who's joining us live. We're really glad to have you here. And those of you who are watching this after the fact, come on in. This is going to be a great hour. I have the great pleasure on behalf of all of us at Leeza's Care Connection to introduce someone incredibly special. Dr. Rosemary Laird is simply the real deal when it comes to the training, the expertise, the experience, and the heart she puts into geriatrics and memory loss, caregiving, mental health, and support. I have known her for over 20 years, and Dr. Laird was a great resource for me when I was trying to find my own way and developing my own place in providing psychosocial support for family caregivers based on my experience with my mom and my grandmother. So I'm deeply grateful for that. And you're going to really enjoy hearing from her today. Among many other things, Dr. Laird is the founder and chief medical officer of My Memory Clinic, which is a telehealth memory specialty clinic. She's done everything in this space, including served as a principal investigator for Alzheimer's clinical trials. She's a faculty member at Florida State University in the Department of Geriatrics, and she is the co-author of the book, Take Your Oxygen First, Preserving Your Health and Happiness While Caring for a Loved One with Alzheimer's Disease. Let's bottom line it. She understands self-care in a way very few do. I'm so glad that you're here. It's so nice to see you, Rosemary. Thanks for doing this with us.
Oh, absolutely, Leeza. Well, if I'm the real deal, you're the real deal right next to me as a family caregiver, because that's where it all started.
It's where it all, and you know what, in the decades since we've known each other, and maybe people joining us today have been walking this path. Maybe some of you are former caregivers turned advocates like me, or you're medical professionals like Dr. Laird. You know that while we are making progress and we do have more awareness, we still come down to that thing, Dr. Laird, which is self-care and how important it is and how seismic it is in outcomes.
Yeah, absolutely. And the other thing, Leeza, is even though we've been doing this as long as we have, there's new people becoming family caregivers every day. So I go from my clinic where we're making diagnoses and meeting people at the beginning stages. And so family caregivers are starting this journey, and it's the same challenge that they see now facing them. So the issue of self-care is really important for all of us to become the sort of stewards of helping get that message out. So no, I talk about it every day. Happy to do it. So with that, if I can I'll just keep moving right along, because what Leeza really helped us realize was that family caregivers need the resources and need the information because of what I just referred to. Nobody expects to become a family caregiver. And so what we've been doing for a long time is trying to arm people with the knowledge of how they can help themselves while their loved ones are getting attended to from the medical side of things. Caregivers very often are not thought of as needing anything during this journey, but we'll talk a little bit today about why that is definitely not the case. So, and the next slide, Amber, we'll go ahead and kind of move into this toolkit that we want to talk about. But first, I want to sort of reference that elephant in the room that sometimes I hear caregivers talk to me about, and that is they say, okay, Dr. Laird, you're going to be yet another one of these people who tells me to take better care of myself while I'm helping my loved one. And I get it. I do. I really understand that you're going to get told that a lot. But today, what I hope to do, and you can hold me accountable if at the end you feel I missed the mark, but what I hope to do today is give you some real action items for yourself, along with and starting with an understanding of why this self-care is so important, so that I think you're going to come away with a different perspective about that. It's not just saying, it's not just lip service. It's something I really want you to to learn today and take forward with you during this journey that you're going to have as a family caregiver. So I like to just get that little disclaimer out, and then we'll move on, I hope, successfully. So one of the things that's really changed a lot since Leeza and I first started talking about these issues is people realize now that there are family caregivers. I think Leeza and I pretty much had to explain to people what a caregiver was in the past. It just wasn't even known that it was a thing. At the same time, we all know about people who have illnesses, right? So if you look at the President Reagan and First Lady Nancy Reagan, I think all of us can know right away what he was afflicted by in his famous letter to the United States people, telling us about his entry into the journey of Alzheimer's disease. But what I want to focus on today is, what did we know about what Nancy Reagan was going through? What did anyone talk about Nancy Reagan was going through? And the answer is not a lot. And yet what we've come to learn is that the family caregiver, through a range of physiologic changes, primarily rooted in chronic stress. Chronic stress is able to do a lot to our bodies, including, as you look down this list of abnormalities that can develop, things like deconditioning, becoming weaker, physical injury as a result. Maybe you're trying to help move your loved one. Maybe you're not able to be as strong as you thought you were, trying to do some activities. Maybe your sleep has been disturbed and you're fatigued. You may have your own memory impairment yourself. You may have worsening chronic health conditions. These are all things that over the years have now been seen in the family caregivers of people with Alzheimer's disease. In addition to issues with higher rates of developing new illnesses, infections, and malignancies. So these are all things that we don't necessarily think of as a risk, but do present themselves to family caregivers who are in a chronic high stress state. In the next slide, we add the element of the risk is also present for our psychological health when we're family caregivers. So depression and rates of depression, rates of use of medication for depression are 2 to 3 times higher in individuals facing family caregiving situations. I'm not saying that that's not appropriate. All I'm saying here is that I want you to be aware of this risk. And it's an important risk to understand. And in some cases, if we can do something to reduce these risks that I've just listed, we would be much better off for all of us, of course. And for you as a family caregiver, wanting to be able to do your job of caregiving, you need your physical and emotional health along the way to do that. Amber, we can go to the next slide. And a couple of newer pieces of information that we've become aware of have to do with a lot of the work of places like Leeza's Care Connection and other caregiving groups that have started to keep track of family caregivers over time. And one of the unique things about family caregiver of someone with Alzheimer's disease or one of the dementia illnesses is the length of time that people are doing family caregiving. I mentioned this chronic stress state that's so damaging to the body. In Alzheimer's disease, the average number of years of someone being afflicted with that and having increasing needs of care goes into the 10, 12, 15-year mark. That's a long time for a body to be afflicted with increased stress. What they're finding from a data standpoint is the stress of family caregivers can impact their immune system for up to 3 years, even after their family caregiving is over. So these are real and lasting impacts in the body. And one kind of chilling statistic, and I promise I'm going to move to the solutions, not as much talking continually about risk, but I can't not put this information out there. These are real risks. One study looked at a couples in which they were both similarly aged. So these were all people over the age of 70. It was husbands and wives in which one of the partners had Alzheimer's disease and was in the hospital setting, and the other was the family caregiver. And when they followed those families over time, there was an increase in the mortality risk of the family caregiver if their loved one with Alzheimer's disease had been hospitalized in the prior year. So these are really, I mean them to be what they are, sobering statistics about the toll that family caregiving can take. But I also want to use it as a jumping off point for, no, that's good, Amber, that's good. This is our, you know, action. This is our saving grace, because Leeza taught me this. You know, this was the concept that got brought forward in that first caregiver support lecture series we did that became this book, was this concept that you cannot, as a family caregiver, provide the care everyone wants to provide if you're not, you know, healthy yourself physically and emotionally. And so this, to me, is an important it's an important mantra. It's an important way of life, actually, as a family caregiver, is that you need to be looking for those moments when you can take your oxygen first. And being here today is a good example of taking some time and taking in some information that's just for you as a family caregiver, but will better your ability to help your loved one. And one of the things I think that I really have over the years taken away from this book and used day after day when I'm talking to family caregivers about all sorts of things, self-care and other challenges, is the way we constructed the message of this book is the information's provided by giving you a foundation of knowledge about the topic at hand. For example, we'll start with some self-care education, but then we're going to move into empowerment. What can you do, knowing what you do about self-care and how important it is? What can you do about it realistically? And then energize. That is that's sort of the icing on the cake. That's the reward for having gone through the process of thinking through the challenge or thinking about the situation you're in, finding out a way to improve it, being empowered to make that improvement or change, and then reaping the benefits, hopefully in a positive way, of what you've done. And that's really sort of a good blueprint for how I try to help family caregivers think about day-to-day life as well as challenges that come up. So I do sort of credit Leeza with this every time I talk about this, because she really was the first person who helped me sort of think that through. Our co-author was a psychiatry trained individual as well, and he helped me think through the understanding of how the way we process information and have things focused makes a big difference on how we use information. So what I want to do now is give you some examples of how to think through this concept of watching out for yourself, both with, we're going to do self-care first, and then we're going to pivot a little bit to a common challenge that your loved ones may face, but might cause you trouble as a family caregiver. And so I'm going to give you sort of two examples. So one of my favorite first examples of thinking about living a daily life as a family caregiver where you take your oxygen first is my favorite rebuttal to my saying that you need to take care of yourself is a family caregiver saying, you know, I'm really kind of short on time. And I know they mean it, and I know it's true when they say it. So I don't belittle this at all. But I also say, all right, everybody, smile, just smile, sitting right where you are. I don't know who's in the room with you, or maybe no one is, but just smile. That act right there helped calm your mind. It helped calm your breathing. And I'm being a little facetious with how quickly those things happen, but they can happen from a smile. Now, take a deep breath. You've all probably heard of the relaxation breathing, right? So we're going to breathe in, smell the roses. 1, 2, 3. Then we're going to blow out like we're blowing out a birthday cake. And that sort of natural, very slow and deliberate action of breathing in and breathing out, we call it relaxation breathing for a reason. It actually does start to bring blood pressure and heart rate down and takes you out of that chronic stress state that you're in. So quite literally, you could take your oxygen first by just taking a deep breath. One little relaxation breath is all I'm asking if you've got a really busy day. But here's the key. This is the piece I want you to learn, even if you've only got a little bit to take away from today. So learn about doing your relaxation breathing, but then see the little italics on the bottom, then repeat tomorrow. The other thing about self-care is that as much as possible, we want it to become a lifestyle of self-care, not just something you do if things start to go south and you try to rally. I mean, it's good to kind of stop yourself from some kind of, collection of negative things. Take a deep breath. But I also want you to think about ways that you can maybe use these small little steps on a daily basis. So give that some thought. Now, let's say you've got just a little more time to give me about the fact that you want to do a better job in the future of self-care. So I might say, okay, good. Well, then let's look at some of the ways research has shown us that we can improve our success in self-care. So we've looked through strategies people have come up with about improving self-care. And I just put them into this little construct to try to be able to make some of these points. But this is an example of educate yourself about the process of self-care. So example, they've done studies looking at the attitude towards self-care. So step 1, your first strategy is believe you should practice self-care. So if you're like really harboring in the back of your mind, like, well, I really, this is selfish, or I shouldn't be doing this, that'll kind of undermine your success. So believing is important. You've got to plan for it. And then you're probably going to think this is crazy, but I'm going to suggest some delegation. So let's go to the next few slides and I'll say just a few more words about that. The reason I want you to believe you should, and sometimes I think that is a very hard thing for family caregivers who seem to be among the more naturally wired people to care about other people first before they would ever turn back to themselves, is I want you to also think about what you're demonstrating to those around you. And especially in a family setting, there can be a lot of really good learnings from the younger generations around you about how we as family members can both help our loved ones, but also do it in a way that doesn't sacrifice ourselves. And so while I want you to believe you should do it for yourself, because I believe you are worthy of having self-care every day in some way, I also want you to realize that and believe that if you're doing that, you're making a statement that could have multiple generations of benefit, not just to yourself, but to others around you. And especially if you've got young people around, keep that in mind, because that can be a very important way for you to demonstrate a good habit for the younger generation. And those of us that are parents know that sometimes the best way to corral your own bad habits is to have the kids around and to know that they're watching. So please believe that you deserve this time, but also realize that you're setting an example. And many times that is a good combination. Amber, in the next slide, after you believe it, you really do have to plan for it. I could show you reams of research that shows that things that happen that we plan for actually happen. And things that things we want to happen if we plan for it, and things otherwise don't. And in the case of family caregiving, there are so many variables to watch out for with regards to the best time of day to have maybe a little break, the best place to have that break, who can help with your loved one. You know the list of issues that there are relating to getting some respite for yourself. But I would say don't let that take you down the path of, no, I can't do that. Instead, try to take some proactive steps, even just small ones, to enable yourself to have the opportunity to do those kinds of respite activities if you need it. And even if it's only take a deep breath and you write that on top of every workday's page or every page in the calendar, that reminder can just be a good way of giving your brain an anchor for something that you want to happen. And once you start doing that, you're going to have better success, both planning it and having things become a good habit. All right, now let's go to delegate, because I get a lot of questions about this, but I really mean delegate. Yes, you must. So I took out can, right? That's because it really, for most of us as family caregivers, it's not going to be a question of if we're ever going to need someone else to help us, it's when. And I think having a mindset that it is okay to delegate in some cases, that's important. And this may not be personal care for your loved one. This might be something for someone helps you, so you offset your time. Instead of doing this item that takes your time, you're going to be free to be able to go to an appointment with your loved one. So it's not, some people find it scary to think about delegating care of their loved one to someone else. But I like to point out that if you're creative and plan ahead, you can actually offer other activities so that you still get to be the one doing the personal care. But I really think it's a must. So much so that I've also done some research. If you go to the next slide, Amber, I've also done some research on this idea of what's a successful way to delegate and to have other people help you. And so this was interesting, putting this together. We have this sort of schema here that there's 3 things you need to do to be successful with a delegation. The first is to choose wisely. So you want to do some thinking about what you're asking to be helped with. There might be certain things that you know that you are the only one you want doing it, and there might be other things that you can let up and have someone else do it. And you just have to pick and choose. Every situation is going to have its own sort of peculiarities, and you are the person who can help decide that. But do that, choose, and find something even small to just start and get used to this concept of delegating. The next is to monitor. Go ahead and set expectations and keep an eye out on things. Delegate doesn't mean you're going to ignore what's happening. Delegate means you've asked someone else to do something. You're still responsible. So I always tell people, even if their loved one's living in an assisted living facility or a memory care unit, you're still the caregiver. You've delegated a certain amount of care to the individuals who run the assisted living facility, but you are still a caregiver. So you're going to monitor, you're going to set expectations and do that. The next point is to be accepting. Different can be okay. So this is where our inner control freak has to kind of quiet down. And the reason I say that is because there often are times where, and we've all had this happen, we all know that we may, many people have different ways of doing things. So my favorite example is I had a family that the caregiver was a self-described control freak, and she would have a companion come for her dad, and she had a whole set of activities that they did every day. So she found out at one point that the caregiver had gotten through all the activities and there still were a few hours left. So she raced back home thinking, what am I going to do to keep the activities going with the companion? And she walked back in and she found them playing chess. And she thought, I don't own a chess set. My dad doesn't know how to play chess. And it turned out they weren't really playing traditional chess, but the caregiver companion had a chess set in his car. He went out and got it, set it up, and they were having a lovely time playing a kind of creative game of chess. And it worked well, and they had a great time, and that ended up being a long-term companion for her dad, who continued to play chess in his own way for a long time. So that's the example of how I think you can think about delegating in a sort of more constructive way at times, and find that at the end, you're going to have a benefit and you're going to be able to be grateful to that individual. And did you know us being grateful is also a way of reducing our stress? So finding those people who you can engage to be in your caregiving journey, you know they're going to appreciate it, enjoy it, but you're going to also find a reduction in your own stress, because gratitude, like I said, it helps us all kind of keep our chronic stress down. All right, next slide, Amber. So through that education, that was kind of a very rapid fire, but an education in the strategies that you can use about why to care for yourself, why to do self-care, and some how to do self-care. So my hope now is maybe you heard even one little thing of what I talked about. So now I hope you're feeling empowered so that you can do something for yourself today and tomorrow. Just pick one thing that we talked about today and add that to your routine. In the book, we talk in these domains of body, mind, and spirit, because we all are all parts of those. All parts of those make us ourselves. And there might be things you need to do on the side of the body. Maybe you need to get that exercise in every day, or maybe you haven't been to the doctor in a few years. Maybe it's for you spirit and a daily prayer or a mantra or something, a gratitude journal. Maybe something like that would be the healing piece that could start you on a positive self-care journey. So think that through. This is where you're empowered, I hope, to make a change for yourself that can be for the better. And the next slide is, I hope that from that, you're going to feel that energy. That's where Take Your Oxygen First is supposed to, go back. Yeah, there you go, Amber, thanks. Because that's where I hope you feel that energy. And maybe you have a little bit less stress. Maybe you enjoy a conversation a little bit more. Maybe the next visit you have with your loved one is just a little bit less stressful, and you can be a little bit more in the moment, focused on the enjoyment of whatever it is you're doing with your loved one or with other family members. That's one of the biggest, I think, tragedies might be too dramatic a word, but I do worry for family caregivers when there are different generations and different relationships that get impacted by the loved one's illness. And we all know that can happen. But I think this is this self-care where you can keep yourself as low stress as possible, I hope gives you an opportunity to have those other relationships not strained excessively by some of these strategies. So, all right, now what I want to do next is, let's say I told you that this Take Your Oxygen First attitude concept and the construct of educate, empower, energize. I think, and I teach family caregivers this all the time, I think that it's a good strategy for anything that comes your way, literally any challenge that comes your way as a family caregiver. So let's see what you think about how this could work. So let's say, and we're going to do urinary incontinence, because the group that asked me to come here to be with you today is a group of people who work for a company that provides urinary incontinence products. And if there's, I have heard for years from family caregivers about that particular problem and how devastating it can be, both to the loved one who's having the urinary incontinence and to caregivers. It's a very distressing situation for everyone. And so as I learned from the company 𝗍𝗍, who I have agreed to speak with, one of the reasons I agreed to speak for them is because they're really focused on trying to, in addition to make sure people have a product that is good and can help, and we'll touch on that in a little bit, they're also interested in getting the word out about ways that we can reduce the challenge and the distress of this really difficult symptom. So I appreciate their letting me have some time with you today. So we're going to use that issue. I do get it constantly. So here we go. Mom's having her neurocognitive decline, and one of the symptoms that can certainly become an issue for many people. Actually, it's almost 75 to 80% of people with Alzheimer's disease will have that over the course of their illness, urinary incontinence. So in fact, this family is actually needing to help their loved one, their mother, find a alternative living arrangement because of her increasing physical problems. So right there, you have this big issue with needing to think about both incontinence and finding a new place for mother to live. So as you undergo step-by-step planning, what I want to do today is we can't tackle the facility placement, but we're going to tackle a little bit of the urinary incontinence issue. So let's go ahead to the next slide, Amber. So I want to start with what everyone should start with, and that is we're going to be educated a little bit about this. And the reason urinary incontinence is so important is because of both, I talked about the distress of the symptom itself. I mean, hands down, everyone can relate to that. But what goes with that symptom, or what can come from that symptom, is this really distressing and damaging cycle of problems. So as an example, on the top right, the term nocturia stands for people who have to get up at night to go to the bathroom. And often that's a time when the incontinence or the leaking of urine happens first. That is associated with a very high risk of falling. Falling is associated with a very high risk of hip fracture in the older population. Hip fracture is associated with a very high risk of admission to long-term care facilities or nursing homes. That is related to a very high percentage of people passing away within the year following this cycle of events. So that's all from having to get up at night and having leaking urine. That's a cycle, and we see it over and over. And it certainly is also along the way of that cycle, things like poor sleep. There's a lot of anxiety and depression that come from just having that symptom in some cases. And we talked about falls. Increased care support. Sometimes it's why people need to move to another facility, to another level of care or a different facility. And we also didn't touch on, but skin breakdown is a big part of it too. So when I talk to family caregivers, while urinary incontinence is a symptom that I said was very common, that doesn't mean kind of like we get to say, well, it's so common, we know it's going to happen, we're just going to deal with it, we're going to let it happen. Now you can see why knowing what that symptom can do if it's left to unchecked, I hope that makes you more likely to ask questions and get some help for this. So the next slide. That's why the educate is so important. The other reason I think it's very important to know about this symptom and that cycle I just showed you is that there is a lot of really good evidence about things you can do to reduce the frequency of urinary incontinence. Now, I didn't say make it go away completely, because that is not what we can do most of the time, is 100% cure, fix, stop urinary incontinence. We can't. But look at what we can do. On the left side, that picture is meant to go along with the famous Kegel exercises, if any of you have heard about that. And while you may think that that's not that's a form of pelvic muscle strengthening that helps hold up the pelvic muscles down in our private area that holds up the bottom of our bodies. That is where the bladder kind of sits. And as we age, it gets very weak. Kegel exercises can be taught and can improve even the older patients among us. And so that's just a good example where knowing that is a reason to go ahead and get some attention about urinary incontinence. In the middle are the famous medications. And while 35 to 55% of the time we can help people, look at how often there are side effects. 35% of the time there are side effects from the medicine. So while I want people to get medical attention for this, we're often going to try to have a combination of medicines and non-medications. And then finally, on the far right, I mentioned to you the company that is making products for this. There is a real increase these days in companies that are focused on making these products because of so many people who need them. But we have to be really careful that people are in the appropriate product, because there are a lot of complications when people don't have the right size or the right type of product to address their need. And in one statistic, up to 90% of people did not have the proper product that they needed to wear. And that can contribute to all those side effects I mentioned. All right, on the next slide. So with that education, my hope would be, if you as a family caregiver know or suspect that your loved one is having some difficulty with urinary incontinence, a great way to start is by completing what we call a bladder diary. And it's pretty straightforward, kind of using that diary concept. You're going to kind of observe and pay attention to what happens over the course of about a week with your loved one's toileting activities. And sometimes it's hard to tell, but you can certainly tell if they typically, if they went in the typical sort of in the bathroom, into the toilet, or if you found evidence of soiled clothing or underwear, if they told you about an accident, you can start just getting some details about what happened and what time it happened, and some of the other details about why they may have had this leaking of urine. And if you take that kind of information down and then take that to your physician, either a primary care provider would probably be the best place to start. That can be a great way to get a discussion going. And with this kind of information, they can have the beginnings of a head start on helping you figure out ways to try to evaluate why it's happening and then try to make some inroads into reducing it. So this is an example of something I would hope you would feel confident doing based on what we've been talking about. And the next slide. Let's see, kind of go back. Yeah, there we go. One more set of things you can do that I hope you would feel empowered to do now that you've been through this discussion is I'm going to give you some of the kind of first steps, things that we tell people to do to kind of help the bladder have a better chance to keep control of everything. So the first thing has to do with fluid intake. So the little saying is only sips after 6. So there's a physiologic reason why when we lay down, our body actually starts to make more urine. And so that's why a lot of people, especially as we get older, have to get up at night. Well, your body's going to make a certain amount of urine no matter what you drink. So if you take care and don't drink too much after 6, sometimes you won't have to get up as often to relieve the amount of urine that's being made. Now, I always have to say, though, that means I'm not trying to dehydrate people. So that means if you can't drink any more after 6 p.m., that means you've got to get all your hydration in well before 6 p.m. in the evening. So it doesn't mean to dehydrate yourself. It just means to pick the time of day when you're going to hydrate. All right, let's go down. Bladder irritants. This is a real common one, especially as we get older. So caffeine and carbonation are two real strong triggers for people to sometimes, once the fluid that's affected by caffeine or carbonation hits the bladder, that is a recipe for someone to have to go to the bathroom very quickly. Well, if a person with an older body has to go to the bathroom very quickly, sometimes that doesn't work well. So you really want to decrease the amount of time that bladder is irritated. Toileting habits in general, something to think about that is generally good for just about everyone is that if your loved one is having issues of getting to the bathroom quickly enough, like I just sort of referenced, sometimes it's because the signal they're getting from their brain is not as as timely as it should be. If you start using a timed void, we call it, where every 2 hours while they're awake, they go to the bathroom, whether they feel like they need to or not, and try to empty their bladder. Sometimes you stay ahead of that problem of the bladder being full and you can't get to the bathroom quickly enough. So every 2 hours tends to be a good time for most people to start with. And then finally, the last thing I'll mention is give some thought to if your loved one is someone who almost gets there, but just doesn't quite get there in time. It could also be what the clothing they have to work through by the time they get there. So is it elastic waistbands would be better than a button fly and a zipper? And also, do they have a good path to the bathroom so that they're confident getting there in a relatively quick amount of time? Or is there something you can do to make sure they get there more timely? So these are an example of things that are in your control, and I hope you would feel empowered to sort of make these adjustments if your loved one had these issues. And of course, you're always talking to your own primary care provider about any of the things I'm talking about changing for your loved one. And the next slide. Thanks, Amber. So speaking of that primary care provider, definitely, whenever there's a problem, while I want you to follow our Take Your Oxygen First schema of educate yourself, part of what you're going to also do is get with your loved one's primary care provider. So find out, use that written description of the problem. In this case, you've got your bladder diary. Ask as many questions as you can. Step 2 is you're going to hopefully, with the help of your primary care provider, have a solution and feel good about putting the solution together. And then, my hope would be also that while you're doing this, think through the use of some incontinence products, briefs that can be used to help with the immediate issue of your loved one very likely will be very embarrassed, and it's very socially awkward to have this kind of a problem known by someone else. So sometimes, even though I have that as step 3, I sometimes flip that and say, first things first, get some briefs so that they feel like they're not, soiling their undergarments all the time, and just get them dry. That feeling is so distressing to people that sometimes is one of the first things I want people to do. Then follow through the steps of really figuring it out. And in the next slide, and I'm sure this is something that the Leeza's Care Connection can get you so that you have more time with this. The company 𝗍𝗍, we worked together to try to come up with some ways to keep people aware and help people understand how to best get a product that will help keep your loved one dry. It has to do with the size. It's very important to have the right size. Too big, they're going to leak. Too small, they're going to feel crummy and potentially still leak. The E stands for essential features. That has to do with there are these days different types of products, whether you're mobile, so you're moving around a lot, or whether you lie down and you don't move a lot, if you sit in a wheelchair a lot. So there's different products that you might use for different people's lifestyle. And that becomes very important. N stands for night and day. Definitely. I mentioned to you that at night, our body actually creates a whole bunch of urine. Well, sometimes that means that at nighttime, there's larger volumes than you could imagine being expressed, because you think, heck, they're not drinking. Why would you need something heavy duty at night? It's because of the way our body works. And then the I stands for this concept of improve the incontinence using whatever strategies you can. And we've now talked about a number today that may be part of how you can help your loved one have reduced incontinence in general. And very often, I mentioned some of those strategies, very often it does take more than one. but most people, about 75 or 80% of people, can have a reduction in their urinary incontinence from some combination of the things we talked about today. Not everyone, but most people, you can at least make a bit of a reduction. So then with all of this, our hope is that you'd be energized a bit. This is a very distressing symptom, but one of my hopes is, and the team at 𝗍𝗍 has a lot of anecdotal stories and other reports from people who use their products and who pay attention to urinary incontinence in this way, of bringing people back into a situation where they feel okay being social again. It's a very, it can be a very strong trigger for social isolation when someone starts to realize they have urinary incontinence or is fearful of it. And so we really are appreciative of the time today to talk about this, because now that you know there are so many things we can do to reduce incontinence, it really does have the potential to make a big difference. So the next slide. So that's my example of how I really think this, what we tried to kind of put as the foundation of this concept of take your oxygen first. I hope that you've seen that it's intended to be a thoughtful way for you to think through the challenges that you're likely to face as a family caregiver, both for your own body, mind, and spirit, and for the good of your loved one, who we hope you'll be able to care for in the way you want to, for as long as you want to. And the next slide. Yeah, and those are really my comments. And I'd be happy to, I don't know how the questions work, but I'd be happy to answer anything I can. And yeah, thank you very much for letting me share some of my thoughts with you today. Thank you.
Always great insights, Dr. Laird. And thank you so much for so many specifics that I know our community always wants to get the education. And we know this is a marathon. It's not a sprint. So at Leeza's Care Connection, as we all know, we recognize that better care for caregivers, when care partners get better care, that translates to better outcome for the care receivers. So it really is the way to offer love for your loved one. And we're all about that notion that you can hang on to yourself even while you're letting go of someone you love. And so I appreciate, Dr. Laird, that you gave us so many insights to really honor our own importance and our own role in the caregiving journey, which does come back to us. And as you say, to take your oxygen first. I think that there's a way for us to look at. You mentioned a few times in your talk, and I think everybody kind of related, oh, I'm a control enthusiast too, and I want to get that schedule, and I want to make sure the people that are on the team are doing what they're supposed to do. There is a time to stop achieving and start receiving. And that business of being able to open up and receive help, support, information, time out, all those things are really important because they're going to get you where you want to go.
Yeah, I love that.
Right. And we
Yeah,
talk
absolutely.
about, you mentioned how to do our, what did you call the breaths, Dr. Laird?
Relaxation
The
breathing.
relaxation breaths.
Yeah,
So
yeah.
we do a thing where we talk about breathe, believe, receive, and it's breathing in the knowledge, and we do something different every time, but breathe in the knowledge that this really is important. Believe that it matters, believe that you can make a difference, and receive the answers and support that other people are giving you. So I think that breathe, believe, receive fits right in with what you've been talking about today.
Absolutely, absolutely. And I'm really heartened. I think the younger generations coming behind us have really shown an open attitude to the fact that we need to find the balance in our
Yes.
lives from a emotional health standpoint, and they're more apt to talk about it and to, you know, share with friends. I've been really impressed with my young adult, you know, children, and how they've, embraced the need to watch out for the others and to be open about their emotional selves. And I think, your Care Connection is a great example where I think our generation of people can feel comfortable, but I'm excited to be able to spread the word that we all need to continue to increase places where we can all feel comfortable about that.
Well,
I think it's so important.
It's so important, Rosemary. You can't heal it if you don't reveal it. And that's why,
Right.
one of the consistent, all our programs are free, as you know, one of the consistent things we do is support in every form. But also we have a program called HUGS, which stands for Helping You Grow Strong. And it teams you up with other people who've walked the path, who have stood where you stand, and who have those kind of street credentials to team up with you peer to peer and get you through it. And that's why times like this, I think, are so important for us to combat the loneliness and the isolation, which I think is probably the biggest risk factor for dementia. So if we can recognize that we're all part of this big circle, we're here for each other, we're going to have better outcomes all along the way.
Absolutely. Well, Leeza, you're still doing it. You're just leading from the place of knowledge. And I can't think of a more authentic way to see things develop for family caregivers from someone who's, had that journey. And so that HUGS it seems like a very natural outgrowth of everything you've been doing for a long time. So
thank you.
Terrific.
Thank you. We again want to thank you. We want to thank 𝗍 for making this possible for us today. And just a reminder for anybody in our community, we are having in Burbank, in the LA area, our senior prom. So this is high school, college seniors, senior citizens, everyone in between. And if you are a senior, we have sponsored tickets through our Send a Senior program. So if you work with a group, or if you are a senior and you'd like to come to our prom, you can just email us. You can email 𝗪𝗍 or Brianna just at leezascareconnection.org. We'd love to see you at the big dance. And it's a retro-inspired night. It comes complete with the prom court crowning of our king and queen. It's the sweetest thing. So we'd love to see you there. So if you want to come, let us know. We've got a ticket for you.
Awesome. Thank you. Well, thank you, everyone. There was no questions in the Q&A. I don't know if anybody has any last minute questions in there if you guys want to ask, but there wasn't any as of yet. So thank you guys so much for spending this hour with us. Thank you, Leeza, and thank you, Dr. Laird, for doing this. And see you, everybody.
Well, Dr. Laird. Thank you.
Very welcome. Oh, you're welcome.
So
you're
great
welcome.
to see you.
Bye, everybody.
Bye-bye.
Bye-bye.